I'm Dr. Donald Gravenor. I'm a medical oncologist and hematologist in the greater Memphis area. I have a great interest and passion for lung cancer, treatment staging thereof, as well as malignant hematology. I'm also very interested in other cancers, breast, colon, digestive, and miscellaneous cancers. Very interested in non-malignant hematology as well as coagulation disorders. Sexuality can be impacted in many ways. First of all, emotionally, one can lose, one can become depressed, one can lose interest, intimacy might deteriorate, plus there are performance issues. Men that get prostate cancer radiation or surgery often have performance problems. Women who are taking anti-estrogens often have issues as well. First of all, you shouldn't abstain from sexual activity. You shouldn't try and suppress your sexual interest. One of the problems, though, is there's often lack of desire, there's lack of mechanical ability to have sex. And I think that this is an area that you might want to speak with your physician or your nurse in the clinic about. Fertility is often influenced by the chemotherapy that you might receive. Certain chemotherapies will almost certainly make you sterile. Other chemotherapies will decrease the likelihood of having children later. Another consideration is the potential mutagenic or chemotherapy effect on one's sperm or ovaries. We have contacts with fertility gynecologist experts, and we can store sperm indefinitely. We can also stimulate eggs and freeze them indefinitely for use at a later date. Sometimes when you're not feeling attractive, it's actually just your perception, your self-perception, your self-esteem. Sometimes you're thinking that the baldness or the loss of hair is important to your partner. It generally isn't. Almost 90% of patients will experience some loss of libido or sexual interest. There are things you can do to reestablish and help yourself, however. One is having maybe a date or a couple's night out where you can just have some romantic or emotional intimacy with your partner. Sexual activity may or may not be important, but it's not the most important thing.